Made with Spoken. How to Emotionally Survive Cancer by Tina Kowalski. Digital narration performed by Anthony Francis, 11 Labs. Chapter 1. My family history is riddled with cancer. A decade before I was born, my maternal grandfather died painfully after a long fight with bone cancer. When I was a teenager, I had one aunt diagnosed with breast cancer, and my paternal grandfather was diagnosed with prostate cancer. He died when I was 15 after it spread to his lungs. My aunt was able to beat her cancer and has been in remission for over 20 years. After 40-plus years as a smoker, my father was diagnosed with a very aggressive form of lung cancer that resulted in a tumor that took over half of one of his lungs. Fortunately, through aggressive chemotherapy and radiation, he beat his lung cancer diagnosis, but sadly, it had already spread to his lymphatic system. He passed away in 2023 after a 6-year fight. So far, I have been the luckiest of the group by getting a slow-growing, non-invasive, and easily removable form of thyroid cancer. I was able to overcome it through the removal of my thyroid and its associated tumors, and the only follow-up treatments required have been a daily dose of Synthroid and biannual ultrasounds for 5 years following the surgery. All of the ultrasounds came back negative, and I was eventually declared cancer-free. I am grateful that my cancer journey was more inconvenient than painful or scary. But watching my relatives and several friends on their cancer journeys has taught me several valuable lessons that I want to pass on so that you can have an easier time if you or someone you know is diagnosed with cancer. Cancer patient tip number 1. Your body has changed. Cancer will change you permanently. Surgery leaves scars and may affect other organs depending on how invasive the cancer is. Chemical and radiation treatments can cause permanent damage to internal organs, may lead to sterility, and may cause hair loss, weight loss, and other temporary side effects. Even if you are particularly resilient and get through your treatments with no problems, the reason for your diagnosis is that your immune system was not able to fight against the onslaught of abnormal cells produced within your body. You can always be diagnosed with the same cancer or a new type, so monitoring your health and doing required checks is essential from now on. Cancer patient tip number 2. Seriously consider receiving therapy. I thought I was okay when I received my cancer diagnosis. I have been a type 1 diabetic since I was 14 and figured that since I was used to having a chronic condition, I would be mentally fine. Also, my diagnosis was not life-threatening, so I never had the sense of panic some people experience when they received their diagnosis. What I didn't count on was the cumulative effect of this new situation on the stresses I already had in my life. When you get cancer, life does not stop to make things easier on you. While you may be able to delegate or eliminate some responsibilities, there are things that only you can handle. You may also be caught by surprise and may not be ready for the list of tests and treatments your healthcare team will be handing you. Lastly, you may not be able to talk to anyone in your current support system because they either will not be able to relate or are unable to handle the additional burden your confession will place on them because they are already worried about you. That is why an older friend suggested I go see a therapist before I started any treatments. He knew that I needed a professional who was outside of the situation to vent to and get tools from to help me with this major life change. If you do not want to speak to a professional, at least look into a support group who can help you through this in ways no one else can. You can never have too many people around you during this time in your life. Cancer patient tip number 3. Know that cancer treatment is both an art and a science. All medical plans should be tailored to the specific situation of the patient. There is no one-size-fits-all approach to cancer treatment. Every patient responds differently. To make sure that they give you the best options for beating cancer, your doctors should take into consideration your medical history, your family history, and all the results of any tests, scans, before giving you a treatment plan. In case no one else tells you this, some of the tests you will have to go through will be either mentally or physically uncomfortable. Blood tests and biopsies can be torture for those afraid of needles. Ultrasounds can be painful if they press down on a tumor to get a clear image, or you may need to undress in front of a stranger and let them touch you in uncomfortable ways. In my case, the biopsy was painful because the tumor was in my neck, and having a stranger stand behind me and wrap their hands around my neck to get an idea of the size and shape of the tumor was nerve-wracking. I had to fight the urge to elbow them in the stomach. Go to your happy place or figure out other ways to endure it, because your doctor would not require you do these things if it was not important. The other thing no one may tell you is that your initial treatment plan may get thrown out the window and you may need to pivot. The doctors will present you with the best option available to either knock the cancer out and save your life, or to knock it back and give you extra time. But until you actually start the treatments, they cannot know how you will respond. After you start treatment, they will continue sending you for follow-up tests to monitor how your cancer is responding, or if surgical intervention was required, to ensure they removed it all and make sure it has not resurfaced. Changes to your plan does not indicate that your healthcare professionals got it wrong, but instead may show that they genuinely care because they have not given up on you yet. Cancer patient, tip number 4. Things are about to get expensive. Cancer can be expensive. Even if you are covered by insurance or government healthcare, certain things like fuel and accommodation for visiting specialists, time off work, or additional medications or equipment may not be covered. You may also need to embrace lifestyle changes you hadn't expected. All of these things can cause significant financial strain, so you need to assess your situation and work with a professional to make sure you will be okay financially. Cancer patient, tip number 5. You may not get the miracle you want. One of the hardest lines that people of faith must say and mean when asking for a miracle is, "Thy will be done." Before asking for a miracle, be honest with yourself about how you will feel with the answer you get. You may want to be healed completely and live your life with as few issues as possible, but instead may be told that you will not beat the cancer, or that all they can do is prolong your life. Now, don't get me wrong, I am a person of faith who knows that people frequently beat cancer cases that the doctors have given up on. And I am so happy and grateful to God for those that do, but I have also seen the frustration of those who asked to be part of that group and are disappointed. This diagnosis may kill you, and you need to find a way to be okay with that so that you do not waste whatever time you have left. Cancer support system. Tip number 1. You need to be proactive in taking care of your mental health. Being the loved one of a cancer patient can be harder than being the patient. Doctors and other members of the patient's medical team will consistently monitor your loved one, but may forget that you are going through this challenge with them. I saw my husband go through this phenomenon on the day of my surgery and have experienced it myself during the years that my father fought cancer, and it has led me to the conclusion that you need to take the steps needed to make sure you are able to mentally handle the stress of the situation. Speak up during consultations and ask questions. Seek out a support group so that you can get the help you need. Vent to a professional and learn tools for dealing with the added stress in your life. Do not let this unexpected challenge lead you to a dark place. The patient needs you, but so do the other people that depend on you, and this does not have to break you. Support system. Tip number 2, you need to be proactive in taking care of your physical health. I was not surprised when I got cancer because of my family history. If you are a first-degree relative of the patient and/or you have a family history of cancer or other health problems, you need to be proactive in doing the things necessary to not only keep yourself healthy now, so that you have the strength and endurance needed to help your loved one, to prevent yourself from becoming a burden in the future. Figure out what lifestyle changes you need to make to reduce your risk of getting cancer, and speak to your healthcare professional about what screenings you should get to ensure you are diagnosed early when cancer is the easiest to treat. Support system. Tip number 3, you need to be okay with the ultimate outcome. The doctors will do everything they can to save your loved one, but in the end, the person may die. Alternatively, they may beat this condition with no lasting effects or may be permanently changed. One of the most important things that you need to do is get to the place where you are able to accept and adapt to all potential outcomes. Also, cancer is such an unpredictable thing that no one can give you all of the answers. Are you okay with not knowing when things are going to come to a conclusion? If not, this may be a harder experience for you than it needs to be. Support system. Tip number 4. It's okay to feel relief when the ordeal is over. A few years ago, my husband and I made several trips after work to visit a good friend of his who had been hospitalized again due to his decade-long battle with brain cancer. We came by every other day before he finally passed away. At first, our friend was aware of all of his visitors, but as things progressed, he lost awareness until he was sleeping most of the time. The last day of his life, his breathing began to fail, and there were several moments when it seemed like this was the end before he rallied one more time and continued the fight. When he finally did pass away, everybody was sad that he was gone, but relieved that he was finally out of pain, and they could move on with their lives. They had mourned his loss for years, and were glad the ordeal was finally over. Similarly, with my father, I knew that each visit and telephone call could be the last one. Distance protected me from having to see him deteriorate on a daily basis, but it also made the changes he was going through more dramatic each time I saw him. I was not there when he died, and am not sure if he was even aware of my presence the last time I saw him. If your loved passes, it is not a betrayal to them if you feel relief that the situation is finally over. You will miss them, of course, but you are still here, and you deserve to have the best life you possibly can. If your loved one beats cancer, celebrate the end of the ordeal. Support system. Tip number 5. Be realistic in how you assist the patient and their loved ones. When a loved one has cancer, you may feel like you want to remove all of the other burdens from them, but that is not realistic. You have your own life and your own challenges that you also need to take care of. Instead, you should examine your situation and determine what you can do to help them. If you don't know what they need, just ask. Even if they say they are fine, they will appreciate that you care and will know that they can ask you for help in the future. On the day that our friend went into the hospital, my husband and I took his children to an indoor play park so their mother could focus on her husband's situation, since all of us thought that he was going to die that day. She tried to explain to them before we left that their daddy may not be around when they got back, but given their ages at the time, it is doubtful that they understood. We never considered taking them permanently. Our work schedules would not allow it, and their mother was better suited for the job anyway. But for a few hours at least, we were able to assist our friends during their time of need, and they were grateful for that. Likewise, with my father, I was not able to assist him physically due to distance, but we kept in touch, and he always updated me on his treatments, new hobbies he had started, and other aspects of his life. He remained positive throughout his journey, and we enjoyed talking to each other. Final thoughts. All chronic conditions have a degree of unpredictability to them that can seem like an insurmountable obstacle. Whether you are the patient or the loved one, you need to remember that you do not have to go through this alone. Use all of the resources available to you to fight against this enemy. I wish you well and hope that you are able to win the fight. We need more survivors.